Life Wisdom.
Hello everyone, this is Dr. Jeff Echols again. I'm very fortunate today to have two young ladies here who are in desperate need of chiropractic care. And today we're going to show you a little bit about how to do some adjustments to the lower back and to the hips. And we'll be evaluating each of these young ladies independently and then showing you how we would go about helping with lower back and hip problems. Okay, so one of the things that we would do in our clinic when we're examining somebody is this is a test called Kemp's test, and it actually just checks for maybe damaged structures here in the lower part of the back. It's to be done very gently and carefully, but if this is abnormal or elicits pain, then oftentimes we'll know that there is a problem in the lower part of the back. And the way we do this is I'm going to put my hand right over her hip right here in the back, and I'm going to reach around this way, and we're going to gently turn you, and we're going to lean you back. And is there any discomfort there?
A little bit right here.
All right, so she gets a little bit of discomfort up a little bit higher in her spine, which is really not normal. It shouldn't be uncomfortable for you just to rotate and bend backwards like that. So now we'll check the other side. Can you turn around for me, please? Perfect. And now you'll be able to see a little bit better where I had my hand. It's right over these little bumps that we get here. We're just going to block here so that the pelvis doesn't turn, and then we're going to rotate her and lean her back. Is there any discomfort there? Okay, now she's really having discomfort there. Can you show me where it is? So she's having discomfort really up here, up in this part of this is called the lumbar spine. So we're going to put her on the table and make an adjustment here and see if that doesn't help some. Okay, so here we are with Mackenzie, and we're going to be looking at her hips here. Now, Mackenzie told me earlier that when she was a young girl, they told her she had a slight scoliosis there. So when I'm looking at her pelvis here, I've noticed that this hip is actually rocked backwards somewhat. And if we come back and look at her leg length, we'll notice that this right leg is shorter now because when the hip is rocked back, it's pulled the femur or the leg bone up. So we're going to put her into a position on the table and then make an adjustment that helps to push this hip this way, bringing the leg length back down and taking care of this hip. Now, when the pelvis is out of alignment like hers is, what do you think that's going to do to the rest of her spine up here? It's kind of like having a foundation of a house that's crooked. It's going to cause things up in the house to start being crooked as well. So, Mackenzie, what I'm going to do is I'm going to have you lay on this side, facing me. Okay. And I'll walk you through this. This is her actual first lower back adjustment. We're going to bend this leg like this. So far, so good. Mm-hmm. Now, give yourself a big hug. You really deserve it for doing all this. Now, this hip here, we're going to move this way. Breathe out. And just relax your hip there for me. There we go. Perfect. Did you feel that move?
Yes.
How'd that feel?
Holy moly.
Holy moly, it felt great. Well, I'm glad. Now we're going to have you roll over on the other side.
Same way?
Yes. Now this arm's going to come like this.
Okay.
Good. Now on this one, we're actually adjusting the hip. This was the hip that had rocked backwards, so we're going to be pushing it up forward. Breathe out for me there. There we go. Did you feel that move?
Yes.
Yes, very good. Excellent. And you can have a seat up for me. You're welcome. So here we are with Miss Corrina now, and we're evaluating her lower back and pelvic area, and she's got a very similar issue. Her right hip is rocked backwards somewhat, and it is making her right leg shorter. So in this case, we're going to have you roll onto your side for me. And we're going to make your head comfortable by lifting this up. Now bend this leg up for me. Good. And there we go. Perfect. Good. Now, that hip moved really good, so what we're going to do is go and get on the other side and move the other hip. There we go. And remember that this is the hip that is rocked backwards, and the short leg, it moves this way. Perfect. How'd that feel? She loves that. All right. So this is just a great way to help people with lower back pain or hip pain. It actually gets to the root of the cause. We're not giving people drugs to just mask the pain. We're actually getting in there and correcting it where the problem lies. So I hope this has been very helpful to you. And if we can help you with any of your problems, please feel free to look us up on the web, www.jeffells.com. Bye-bye.